An epidemic, either naturally caused or intentionally caused, is the most likely thing to cause, say, 10 million excess deaths. And that it's pretty surprising how little preparedness there is for it.
A few months ago, I posted on my social media, Facebook to be precise, that I was getting vaccinated. This single post caused a lot of reaction on my Facebook page. Somebody even said something like, there is a Facebook group of over 100,000 people reporting side effects after days and weeks of taking the vaccine. Have a look on the page. Across social media, there's so many ideologies, especially the ones targeting Africans, saying Africans are the main target of this COVID-19 vaccination. This led me on the discovery journey to seek medical practitioners' advice and tips from them to know what exactly is COVID-19 and what the vaccine all about. So I took a trip to a doctor in Ayrshire in Scotland to ask him what his own opinion is about COVID-19, his opinion about the coronavirus vaccine as well.
There's some diseases that are quite difficult to treat, and for that reason, what science has done is to try and create something that will go into the body and prepare armies ready for that infection. So for example, by getting the vaccines, you have a primed antibody into your body so that should you become infected again, your body will be not without any harming and can do the job, fight and make sure even if you end up having the disease, it can be as mild as possible and it's not something that's going to kill you as much as possible, get you very sick. So that's the whole idea of the vaccine. Take a part of the virus or something causing the infection and put it in the body for the body to recognize it, to create antibodies ready for the time you now become properly infected with that disease, such that you're ready to fight and your body can deal with it much better than having nothing on board at all.
So in order to get another doctor's perspective, I've traveled all the way down to Edinburgh to meet Dr. Janita, who would also shed more light on the coronavirus vaccine and how it affects Africans and other black ethnic minority people.
Black population across the globe, not just the UK, so UK, US, and parts of Africa, it's been in the news that black people are more vulnerable to the virus. And it's not that we are vulnerable because we're black, we're vulnerable because of the structures of society. The way the society has been structured, black people occupy spaces and work in jobs that make you vulnerable to infection, such as healthcare, transportation, different front-facing jobs in the food industry. These occupations did not have a pathway for working from home. You had to leave your home. Black people are more vulnerable simply because we are overexposed and underprotected. The vaccine is going to be important to protect yourself and your family. I understand that some people are cautious and hesitant to take the vaccine due to historical atrocities that have been done to African people across the globe. These things cannot be dismissed. I understand the concern. With coronavirus vaccination, it is important to note, while it seems to be a new vaccine that kind of popped up overnight, that's actually not the case. It was produced on the back of other vaccines that were being produced for the SARS virus and the MERS virus, and so it was built off of a foundation. So it wasn't that it was created from ground zero overnight to target coronavirus. So there was years of science behind producing a vaccine for COVID-19.
The beauty of thing is we've seen that 99%, 95% in some cases, and some cases can be as low as 60%, that kind of thing. But at least there's something on board. What it means is it prevents hospitalization, it prevents death, it prevents need for being on the ventilator. So we don't just get attacked by COVID and have nothing in our body to fight at all. There's something on board to fight, and so we can wage a war and not just be like we're harmless totally and let COVID ravage our body. So that's what's all about, really.
I decided to seek advice from black activists that have over the years been agitating for the better life of black men in Scotland. I went all the way to them to ask them what are their thoughts about coronavirus, and I wanted them to clear the air if they have any idea that this vaccine and the coronavirus is being targeted at Africans, either to reduce our population or for whatever reason.
I think black people and many other non-white people have refused to take the vaccine, and they refused to take the vaccine because of misinformation. But it's not just misinformation. They refused to take the vaccine because I think that initially what the government should have done is the government should have been giving out the advice with black experts and non-white experts standing next to the government official. And the point is that because that wasn't done, therefore this was information coming from the white system. Now, the point is, if you're talking about a medicine or a vaccine, the point is it's new. And people then are saying, well, this is about white people, it's not us. We have to then be suspicious. And of course, with the media supporting that view, then many black people and non-white people refuse to take the vaccine.
Yeah, I think the first thing to say, of course, is that it's not genetic. We are not genetically predisposed to the disease. What we are is we are socially predisposed to this, and because of the social disadvantages we suffer from, these are the reasons why we're more susceptible to this disease. This disease, if you had a map for where this disease is prevalent versus where, and if you had a map of the social indices of deprivation, you'll find that they completely overlap when it comes to BME communities, particularly the Africans, Pakistanis, Bengalis, etc. So the fact is, it's because we suffer poverty, discrimination in the geography of housing, where jobs are, where we live, we're more likely to live in close proximity to each other. We're more likely to live in multi-generational households. So it's not a genetic thing, it's a social thing. If COVID is racist, it's because society and is institutionally racist, and that pre-existing racism has made us more vulnerable to this.
And what is interesting is that the information that a black expert is putting out is not only for black people, but it's also for white people. It's the same information that both sectors of the population need. And I think it would be a good thing, because then we will be saying to the white population that non-white people contribute to this society. They have an expertise that this society requires. And therefore, I think, get black experts, non-white experts to talk to the population as a whole. And I think that will change attitudes.
Let's take the silly conspiracy theories out of this. The one I've heard, which has been most prevalent, the idea that Bill Gates somehow has nanotechnology in the vaccines just because they want to follow us around and find out what we're doing. First of all, do you really think they need to do that, whoever they are, when we've all got mobile phones which tell us exactly where we are, who we've been looking at and what we've been buying online? So they don't need to do that. And secondly, why would they be interested, really? Do they really want to know what your shopping habits are? Well, yes, to a degree, but they have the technology to do that in other ways. They're not going to do that for a vaccine.
The new Omicron variant of the COVID-19 virus is a clear outcome of the lack of vaccine equity. Mutations occur when there are high levels of community transmission of a virus. It was very clear that the North had a higher accessibility to the vaccine than the global South. And as a result of that, high levels of transmission continue to occur across different parts of Africa, and as you can see, the Omicron variant has come about. And this is a clear result to hoarding of vaccines and lack of equity. This is another way it shows that our health across the globe is interconnected. No group, no population can be ignored when we're talking about saving the lives of ourselves as well as our community. Vaccine equity is a must.
All our society is full of good people. Our society, is full of good people. And what I mean by good people are people who wouldn't want to infect somebody else with this virus. So a good person is somebody who even if they have the virus, they wouldn't want to infect somebody else. And I took my vaccine because I didn't want to do that. I want to be as safe as possible in terms of my health and the health of my family. But I also wouldn't want to go out, whether I knew or not that I had the virus. I wouldn't want to infect somebody else because I wouldn't want to damage somebody else's family member. And I really believe that if people are told that and they understand that this virus can be passed on, just by speaking closely to somebody, I think people would take the vaccine because people don't want to hurt other people. And I really believe that.
There is a problem, of course, of equality here and power, which is about the international institutionalised racism of the system. So I think people are completely understandably sceptical about the motives of big pharma, as they call it, or international science. But there are some obvious facts about how science works and about how vaccines work. And it's not rocket science here. It is very simple. Vaccinations work. They're proven to work. They have worked in Africa, despite some of the problems around the equality issues. They have eradicated many diseases. Polio has been eradicated pretty much from Africa. When the Ebola crisis has happened, each time it's been contained, those outbreaks, of course, there's a problem of how it arose, but each time science has come to the rescue. This is the answer now, and the proof is in the pudding. Many of us have had it. I'm double vaccinated. I'm encouraging everybody to do that because that is the only way forward. We need actually vaccine equality, an end to vaccine imperialism, so that actually the people in Africa, the Caribbean and Asia, they need to have this protection too, because while this virus, and particularly this Delta variant of it, has a time to incubate and develop mutations, it's going to be mutations amongst our people who are unvaccinated where we're most vulnerable to new strains emerging. We saw that with the South African variant, that when that was allowed during the first couple of waves, that then came back and kicked us all much harder. Let's remember, black people more than anybody else, black and Asian people, will suffer more from not being vaccinated. They will die in greater numbers. The proof is there in the stats. We are more likely to get it because of the social conditions in which we live. We're more likely to be seriously ill from it, and we're more likely to die from it. So to my mind, to not to take it, and indeed to put propaganda out there to encourage black people not to take it, is anti-black. And people should need to understand that. It's not a racist motive to want to be vaccinated. It's a racist motive to want us to not be vaccinated.
Having listened to these medical practitioners and activists, I am not in any doubt that the coronavirus vaccine is good for everyone. It's a sensible thing for us to do, and it will help us protect ourselves and our loved ones. So I encourage you out there, do get the vaccine when you can.